Cancer, it's a word that strikes fear into the hearts of many. For decades, the battle against cancer has been waged with surgery, radiation, and chemotherapy. These traditional approaches, while often effective, can come with significant side effects. Now, a new wave of cancer treatment is emerging, one that harnesses the body's own immune system to fight this deadly disease. These game changers are called checkpoint inhibitors. Checkpoint inhibitors represent a paradigm shift in cancer treatment. Unlike traditional therapies that directly target and kill cancer cells, checkpoint inhibitors work by unleashing the power of the immune system. Our immune system is a complex network of cells and proteins that constantly patrol the body for foreign invaders like viruses and bacteria. It also plays a crucial role in recognizing and destroying abnormal cells, including cancer cells. However, cancer cells are crafty adversaries. They often evolve ways to evade the immune system's detection and destruction. One way they do this is by exploiting checkpoints, which are molecules on immune cells that act like brakes, preventing the immune system from attacking healthy cells. Cancer cells can hijack these checkpoints, essentially putting the brakes on the immune system and preventing it from doing its job. Checkpoint inhibitors are designed to release these brakes, allowing the immune system to recognize and attack cancer cells more effectively. This novel approach has shown remarkable promise in treating a wide range of cancers, offering new hope to patients who may have exhausted other treatment options. The development of checkpoint inhibitors is a major breakthrough in cancer research, opening up a new frontier in our fight against this devastating disease. To fully appreciate the significance of checkpoint inhibitors, it's helpful to understand how they differ from traditional chemotherapy. Chemotherapy drugs are cytotoxic, meaning they work by killing cells that divide rapidly, a characteristic of most cancer cells. While effective in shrinking tumors, chemotherapy doesn't discriminate between cancerous and healthy cells. This lack of specificity leads to a wide range of side effects, such as hair loss, nausea, and a weakened immune system, as chemotherapy also damages rapidly dividing healthy cells, like those in hair follicles, the digestive system, and bone marrow. Checkpoint inhibitors, on the other hand, work by enhancing the body's own immune response to cancer. This targeted approach means they generally have fewer and less severe side effects compared to chemotherapy. Instead of directly killing cancer cells, they empower the immune system to do the job itself. This distinction is crucial, as it represents a fundamental shift in how we approach cancer treatment. Chemotherapy often works quickly to shrink tumors, but its effects are often short-lived. Cancer cells can develop resistance to chemotherapy drugs, leading to relapse. Checkpoint inhibitors, while they may take longer to show an effect, can provide durable responses, meaning the cancer remains controlled for extended periods, even after treatment is stopped. This long-lasting benefit is attributed to the immune system's ability to remember and target cancer cells, even if they reappear. The distinct mechanisms of action between checkpoint inhibitors and chemotherapy underscore the revolutionary nature of this new treatment approach. It's not just about killing cancer cells, it's about empowering the body to fight cancer from within. This shift in perspective has the potential to transform the cancer treatment landscape, offering new hope for patients and their families. To truly grasp the transformative potential of checkpoint inhibitors, we need to delve into the intricacies of the immune system. Specifically, let's explore the PD-1 pathway and how its manipulation forms the cornerstone of this groundbreaking therapy. PD-1, short for programmed death 1, is a protein found on the surface of T cells, which are specialized immune cells, crucial for recognizing and destroying infected or cancerous cells. Think of T cells as the body's elite soldiers, trained to seek and eliminate threats. They roam the body, scanning cells for signs of danger. When a T cell encounters a cell displaying abnormal proteins indicating infection or cancer, it binds to these proteins using its own receptors. This binding triggers a cascade of signals within the T cell, activating it to unleash its killing power upon the rogue cell. However, the immune system has a built-in safety mechanism to prevent overactivation and potential damage to healthy tissues. This is where PD-1 comes in. When PD-1 on the T cell binds to its partner molecule, PDL1, found on other cells, it acts as an off switch, suppressing the T cell's activity. This interaction ensures that the immune response remains controlled and doesn't go into overdrive, attacking healthy cells. Cancer cells, being masters of disguise, have learned to exploit this delicate balance. They often overexpress PD-L1 on their surface, effectively hijacking the PD-1 pathway to evade immune detection. By binding to PD-1 on T cells, cancer cells send a "don't eat me" signal, putting the T cells to sleep and preventing them from mounting an effective attack. Section 4. Hope, remission, and durability. The promise of checkpoint inhibitors. Checkpoint inhibitors, specifically those targeting the PD-1 pathway, have emerged as a beacon of hope in the fight against cancer. By blocking the interaction between PD-1 on T cells and PD-L1 on cancer cells, these drugs essentially cut the brakes on the immune system, allowing it to unleash its full fury on the tumor. The results have been nothing short of remarkable, with some patients experiencing complete remissions, even in advanced stages of the disease. What sets checkpoint inhibitors apart is not just their ability to shrink tumors, but their potential to induce durable responses. Unlike traditional chemotherapy, which often loses its effectiveness over time, checkpoint inhibitors can provide long-lasting control of the disease, even after treatment is discontinued. This enduring benefit stems from the unique mechanism of action of these drugs, which empowers the immune system to remember and target cancer cells long after the initial treatment. Imagine a scenario where cancer, once a dreaded and often fatal diagnosis, becomes a manageable chronic condition. This is the promise that checkpoint inhibitors hold. While not a cure, these drugs offer a new paradigm in cancer treatment, shifting the focus from simply extending lifespan to improving quality of life and potentially achieving long-term remission. This transformative potential has ignited immense excitement within the medical community and sparked hope in the hearts of countless patients and their families. The groundbreaking nature of checkpoint inhibitors is evident in the sheer breadth of cancers they have shown promise against. From melanoma and lung cancer to bladder cancer and Hodgkin lymphoma, these drugs are demonstrating efficacy across a wide range of malignancies, revolutionizing the treatment landscape for once devastating diseases. The remarkable success stories emerging from clinical trials and real-world applications of checkpoint inhibitors are a testament to the transformative power of this novel approach to cancer therapy. Section 5. Challenges and limitations. Navigating the uncharted waters of immunotherapy. While the advent of checkpoint inhibitors represents a paradigm shift in cancer treatment, it's crucial to approach this breakthrough with a balanced perspective. As with any new therapy, there are challenges and limitations that need to be addressed. One significant hurdle is the relatively low response rate observed in many cancers. While some patients experience dramatic and durable responses, a significant portion sees little to no benefit from these drugs. This variability in response highlights the complexity of the immune system and the challenges in predicting which patients will benefit most from checkpoint inhibitor therapy. Researchers are actively working to understand the factors that influence response, such as the type and stage of cancer, the patient's overall health, and the presence of specific genetic mutations in the tumor. Another challenge is the potential for immune-related adverse events. By unleashing the immune system, checkpoint inhibitors can sometimes trigger an overzealous immune response that attacks healthy tissues, leading to a range of side effects. These immune-related adverse events can affect various organs, including the skin, gut, liver, and endocrine glands, and can range in severity from mild to life-threatening. Managing these immune-related adverse events requires careful monitoring and prompt intervention with immunosuppressive medications, such as corticosteroids. Physicians are continuously refining their understanding of these side effects and developing strategies to mitigate their impact on patients. Despite these challenges, the potential benefits of checkpoint inhibitors, particularly their ability to induce durable responses and improve long-term survival, outweigh the risks for many patients. Section 6. A future forged in hope and scientific endeavor. The emergence of checkpoint inhibitors marks a pivotal moment in the ongoing battle against cancer. While challenges and limitations remain, the groundbreaking nature of this therapy, coupled with the relentless pursuit of scientific advancement, fuels a sense of optimism for the future of cancer treatment. The journey ahead is paved with ongoing research and clinical trials, aiming to unravel the complexities of the immune system and optimize the use of checkpoint inhibitors. Scientists are diligently working to identify biomarkers that can predict which patients are most likely to benefit from these drugs, sparing those who are unlikely to respond from unnecessary treatment and potential side effects. Efforts are underway to develop novel combination therapies, pairing checkpoint inhibitors with other cancer treatments, such as chemotherapy, radiation, or targeted therapies, to enhance their efficacy and overcome resistance. The future holds immense promise for personalized cancer treatment tailored to each patient's unique tumor characteristics and immune profile. Imagine a world where cancer is no longer a death sentence but a chronic condition managed with minimal disruption to quality of life. This is the vision that drives researchers, clinicians, and patients alike. The discovery and development of checkpoint inhibitors serve as a testament to the power of human ingenuity and the unwavering spirit of scientific exploration. As we delve deeper into the intricacies of the immune system, we unlock new possibilities for harnessing its power to combat this devastating disease. The future of cancer treatment is being rewritten, and checkpoint inhibitors are leading the charge.